using acronyms and legislative language might work on Capitol Hill, but when you're actually speaking to people, you need to speak to what actually matters to them.
I think it's transparency. I think everybody's just really ready, whether it's a hospital trip, drug pricing. I think all the American public just wants to know what goes into the cost that they're saying that they're footing the bill for.
Annalise and Adam, welcome to our wonderful podcast here. I'd love to start off with just, quite frankly, an icebreaker. What do you do? This town, here we are in Washington, D.C., this town is wound pretty tight with a lot of type A personalities. You see a lot of people jogging on their cell phone. You see a lot of people at the soccer games, obviously with their smart device because they're constantly wired. But what do you do when no one else is watching? What do you do on a Saturday or Sunday just to kind of decompress? Annalise, let me start with you.
So I really like to escape not only Washington, but I guess this entire world and read science fiction books. So I recently started the Red Rising series, which I'm like super late to the game on, but it's post-apocalyptic, planetary
you go there.
challenge.
Okay.
Yeah. I'm just like, I want to really zoom out.
Wow. I mean, you talk great, literally to another world.
Exactly. Yeah.
Adam?
It's an escape.
For me, I'm chasing around my 4-year-old. So we live on Capitol Hill here in Washington. You can find us at Eastern Market running around. But wherever she's going on the bike, I'm usually hot on her tail trying to keep up.
So you got your priorities straight. I understand.
That's what we do.
So the two of you work at 7Letter, and for the best interest of our folks that are watching, that is a public affairs firm here in Washington, D.C. In full disclosure, you work with us as we think through healthcare policy, as well as messaging. Tell us about your roles at 7-Eleven. Exactly what do you do? Annalise?
Yeah, so you're exactly right. It's a public relations firm. We help associations like yourself, but also corporate clients. We have industries across the board that we assist, and we assist them primarily with communications here in Washington, D.C. So we're not necessarily a consumer-focused public affairs company, but we're talking to, opinion elites. We're talking to key stakeholders here in Washington. We're talking to lawmakers. We're talking to policymakers, and we're helping shape the narratives that best resonate with those decision makers on a particular issue.
Adam?
Yeah, clients come to us most often when they have a challenge or an opportunity, especially when they need to communicate to a niche audience, a special audience, an influential audience. And we have expertise at finding them, building the audience, and communicating and reaching to them. So whether it's healthcare, stakeholders, or any number of industries, we find ways to develop, build, and communicate those messages that are important to them.
One of the things I always find challenging, but also, quite frankly, creatively interesting, and that is how do you take really complex domestic policy issues such as healthcare, which is extremely important for obvious reasons. And I don't ever want to use the word dumb it down. That's offensive. But how do you make it digestible or consumerized for our parents or our grandparents to understand? Do you find that challenge or that tension to be hard as well?
Yeah, I think that's right. I mean, I think a lot of industries can get caught in their own acronyms, and it can be really simple measures. I mean, you're saying the same things, you're just using language that's familiar to people. You have to kind of cater your message to your audience, and if you want an audience, if your audience is the American public, you have to understand that they're not going to understand the same kind of terminology that we often use here.
Yeah, you said it. Annalise said it too. I mean, you both talked about audience. You don't have to dumb anything down. You just speak the language the audience will understand, right? So if you're talking to the consumers, you talk about how the price they pay or their experience at the doctor is or is not changing. When you're talking to lawmakers, you're talking about why policy needs to be changed or strengthened to protect consumers. But lawmakers are kind of megaphones for their constituents, right? So you need to speak to them in a language they can understand too. So Annalise is exactly right. I mean, using acronyms and legislative language might work on Capitol Hill, but when you're actually speaking to people, you need to speak to what actually matters to them.
Yeah. Let's talk about healthcare for a moment, right? That's the business that we're in. based on all the polling data that you've seen, all the research that you've done, is it fair to say that healthcare issues is not a top priority in this Congress for the remainder of the year, or no?
What I would say is that funding is going to be the top issue. But I think for the American public, the top issues are the economy and inflation. And I bring that up because I think that relates directly to healthcare.
Right.
And I think healthcare costs are a top issue. Now, whether or not Congress is able to sort of get it together and get anything done with respect to healthcare, I think that's another question. And I think there's been a lot of important work on healthcare done across the year in Congress. It's just like many other things, and unfortunate fall into the wayside of the dysfunction.
Let's translate this, because I think the American people at home are saying, can they just get something done on behalf of healthcare? This is important to me,
Yeah.
right? So I hear and see a lot of bickering, but I'm not sure I see any solutions. Is that fair?
Yeah, I think that's absolutely fair. I do think what's been interesting to watch is the presidential conversation around healthcare, because I think that's kind of a good litmus test as to how much the American public is sort of calling out for a conversation around healthcare. You're hearing kind of a more populist message from Republicans. If you watch the Republican debates, I think the candidates are very focused on transparency, but they're also, kind of not talking about healthcare in the way that we've traditionally seen Republicans talk about. And with respect to Democrats, I'll let Adam jump in on this one. But my 2 cents is that while I think Democrats will still be interested in an ultimate goal of Medicare for all, I don't think you're going to see a Biden administration pushing for that in the same, there's not going to be the same conversation around Medicare for all that we saw in 2020 when we had a Bernie Sanders primary. I think the Biden administration is going to be more focused on sharing and defending and publicizing their record of the things that they've been able to do for healthcare.
Yeah,
Anything you want to share?
I think she's right. I think the fact that the Republicans have the national Republicans, I should say, the Republican presidential contenders have kind of left the field open on the healthcare policy issue, gives the Biden administration a chance to talk about strengthening the ACA, finding ways to increase affordability and transparency, finding ways to, whether through executive action or those few glimmers of bipartisanship that exist on Capitol Hill, get a couple things across the finish line that actually impact what the price people pay or the experience that they have. And I think that will be an opportunity for them. I agree. I don't think there's going to be any sweeping, especially with divided government, policy proposal on healthcare. But I think the Biden administration will continue to talk about ways to strengthen the ACA.
All right, we got to talk about the elephant and the donkey in the room, and that's 2024. Is healthcare going to be a dominant issue between President Biden running for re-election and whomever the Republicans nominate as their nominee?
Well, I'll take this one first. I think, the nature of an open primary like we see on the Republican side means that it's kind of being defined week over week as those candidates kind of take their positions. And I think that it's also being defined by former President Trump as the big elephant in the room there. And I think that it's not exactly so far, and I'm not sure it will be exactly like a laboratory for policy ideas, right? It's going to be them making their case for their constituency, for their base. And I think that gives, like I said earlier, the Biden administration the Biden campaign a chance to run on their record.
Yeah,
Annalyse?
I think that's right. Generally speaking, I think Republicans. They all kind of pivoted quickly in the second debate when they got the one healthcare question. They were like, but I want to go back to foreign policy. So I think you could kind of see that they don't really have a lot to talk about, and maybe that will change. I think Nikki Haley had a little bit more to say there in her response, and so it doesn't seem to on its face be one of the biggest issues. But I think where it will continue to come up is with costs. And I know I've said that before, but I think the American public are really concerned about the economy right now, and I think that's a big part of the economy. And just the fact that healthcare prices have gone up so high, far exceeding the other inflationary costs that Americans are grappling with right now. So I don't see it as being a big laboratory of ideas either, unfortunately.
But our research shows over and over again, our firms, we do a lot of survey research. We talk to a lot of people in focus groups, and, people are informed about their healthcare costs there, and they know what they pay. They know how it feels for them. And so when you ask them what's their number one issue, healthcare might not be number one issue, but cost is probably one or two. And if you ask them to pick three top issues, healthcare is usually one of the top three. So that's interesting.
We got a few seconds left. I love to ask this question at the end, and that is the next big thing in health, according to you, Annalyse?
I think it's transparency. I think everybody's just really ready, whether it's a hospital trip, drug pricing. I think all the American public just wants to know what goes into the cost that they're saying that they're footing the bill for.
Adam, the next big thing in health for you?
So go a little bit different. I'm going to say AI. I think both challenges and opportunities in how consumers interact and how companies interact with consumers on it, but also the potential for breakthroughs on the actual healthcare delivery side. But there's so much unknown, so many people trying to tap into it. It'll be interesting.
Thank you both. Really appreciate it.
Thank you.